Well, thanks everyone for joining us this evening. This is Kristen Bentley from the Retired Racehorse Project, and I'm happy to introduce Dr. Sarah Roos tonight. Sarah Roos, VMD, DAC VIM, serves as an equine technical manager with Boehringer-Ingelheim Animal Health. She attended Penn State University for her undergraduate degree, then obtained her VMD from the University of Pennsylvania. After an internship at Equine Medical Center of Ocala, she next completed a large animal internal medicine residency at Texas A&M University. Dr. Roos then practiced general and specialty medicine at McKinley and Peters Equine Hospital in Spokane, Washington. Pursuing her love of teaching, she joined the faculty at the University of Florida's College of Veterinary Medicine in 2010, serving as a clinical assistant professor and chief of the large animal medicine service. Dr. Roos transitioned to industry in 2016, first with Muriel, who was then acquired by Boehringer-Ingelheim. Her professional interests include gastrointestinal disease, neurology, endocrine disease, respiratory disease, and infectious diseases of the horse and foal. She's also active in organized veterinary medicine, currently serving on the AAEP Board of Directors, in addition to roles in the ACVIM, AVMA, and the Veterinary Leadership Institute. In her free time, Dr. Roos enjoys traveling, running, kayaking, hiking, and riding her Dutch warm-blood mare. I'm going to turn it over to Dr. Roos, and she's going to present to us innovations in equine asthma.
Perfect. Thank you, Kristen. I also realized I feel as though I should, especially in this crowd, tell you all that my first love is actually the off-the-track thoroughbred, and that's what I always grew up riding. I did the thing you're never supposed to do as a veterinarian, which is that I took home a patient, which is why I now currently own a warm blood. But I am a big fan of the thoroughbred. So we will get started. And Kristen, just interrupt me if any questions come through, or there's any major technical issues or anything like that. But otherwise, we are going to go through equine asthma. So we'll start with some fun facts because I like fun facts. So at the full gallop, a horse takes in upwards of 5 gallons of air per second. So you all have carried a 5-gallon water bucket. Your horse is moving at least one of those per second through their lungs when they're galloping. I think most people know this, but horses can only breathe through their noses. I find this one interesting. So horses hold their breath over jumps. I also, as a very wimpy adult amateur, also hold my breath over jumps and often am forced by my trainer to sing out loud so that I have to breathe. But your horse is also actually holding their breath over each fence. And horses, really relative to all of our domestic species, probably have the most large and impressive respiratory system. And if we actually took the horse's lungs and kind of open them up so that all of their air exchanging surfaces were laid out flat, their lungs would actually occupy 10 tennis courts. And so again, it gives you an idea of why horses can do the things that we ask them to do from an athletic standpoint. And then respiration is tied one-to-one to the stride at the gallop. And so again, especially, this was kind of first discovered with some of this, time-lapse type photography, where essentially, as the horse is elevated, they're inspiring, and then as that leading forelimb hits the ground, that causes them to expire. And so anything that affects breathing can shorten the stride and vice versa. So certainly, for horses when they're racing, this is a huge deal. But again, even any horse that does anything at any sort of speed becomes really important to be able to time their respiration and their gait. And so because of that, obviously we want our equine athletes to have a good functional respiratory system. And certainly there are plenty of infectious diseases that can compromise their ability to do so. But we also have this group of non-infectious diseases, and they've gone through a variety of different names. And so some of you, kind of depending on how long you've been in the equine industry, may have heard a variety of these sorts of terms. So initially it was described as broken wind, and actually Aristotle described that when he actually wrote some pieces about horses even back in 300 AD. So it's a disease that's been around for a long time. I think Heaves is probably one of the more common horse owner terminology for what we're now calling equine asthma. There's a period where we went through pulmonary emphysema and COPD. We've tried to really phase those out of our equine vocabulary. For the last 15 or so years, as veterinarians, we were pretty adamant about calling it either recurrent airway obstruction, which was kind of that more classic Heaves, which could either be barn associated. So for those of you who have horses in the north, These are the horses that do poorly in the winter when they're locked in a barn. For any of you in the Southeast, you may have personally experienced or heard of summer pasture-associated heaves, which affects horses more when they're turned out. And then we also had inflammatory airway disease. And so again, honestly, as veterinarians, we were making this probably more confusing than it needed to be, both for ourselves and certainly when we would talk to horse owners. And so really just about the last 5 years, we've kind of all agreed, let's just call it equine asthma and let's make it simple. Let's make it terminology that everyone's a little bit more comfortable with and more familiar with, so that we know that we're all talking about the same thing when we're talking about these non-infectious lower airway diseases. And partially that becomes easier because most people have some experience with human asthma. So whether you suffer from it yourself, you have a child who has, a friend, someone has dealt with human asthma in their past. And so when we say the term asthma, you know what we're talking about. And really, equine asthma is very similar to human asthma. And so again, for any of you who may be asthmatics, or I feel like half the time when I do these, all of a sudden there's some, like human pulmonologist that ends up on the line that likes to ask me stumping questions. But human asthma, again, is very similar to equine, where it is this chronic airway inflammation. And much like our horses, most people also have this history of respiratory signs that vary over time and intensity. So there may be times of year or certain circumstances where you and or your horse look great, and other times that you have a lot of issues. And this can be measured in people with a lot of what we call pulmonary function testing. We'll talk about that briefly in horses, but right now, at least in horses, it's not as readily available as it might be in human medicine. So again, if you or a family member has been diagnosed with asthma, you may have done some of these breath holding exercises and whatnot for some measurements, and you'll notice that in general, we're not necessarily doing a whole lot of that with our horses. So like I said, we've kind of played with the terminology over the years, and for a long time, again, we had what we were calling inflammatory airway disease and recurrent airway obstruction, and we've really divided those now into mild to moderate asthma and severe asthma. And so when we talk about mild to moderate asthma, this is often our young to middle-aged horses, and so especially this category, the mild to moderate, we can see in 2- and 3-year-olds. A lot of horses on the track may actually suffer from some periods of mild to moderate asthma, even as a thoroughbred in training. And these horses with the mild to moderate variety, it's an occasional cough that lasts for 3 weeks or more. These horses, often their predominant issue is poor performance or exercise intolerance. So they're just not able to keep up with their job. The good part about mild to moderate asthma is that it can improve and it can be reversible. So again, some of these horses may have issues as, again, 2- or 3-year-olds, and essentially they kind of outgrow it. Environmental changes can happen and whatnot that they don't continue to have problems for their entire life. So again, somewhat similar to juvenile asthma for any of you who have maybe had a kid who has had asthma. The severe asthma category fits in what we used to call recurrent airway obstruction or heaves. And these are the classic horses. So these are the slightly older. In general, we're not seeing the severe form of asthma until horses are 7 years or up. And these horses certainly will have exercise intolerance and performance issues, but also will have clinical signs at rest. So they may be coughing at rest or at the beginning of exercise, and they may have an increased respiratory rate and effort even at rest. And the thing that's unfortunate about the severe asthmatic horses is that while their signs fluctuate, the disease itself is recurrent and progressive. So kind of once they've flipped into this more severe category, even though again, there may be certain times of the year, certain circumstances where they look pretty good, we have more and more evidence that we actually do have structural change to their lungs, essentially what we call remodeling, that again becomes important to us, when we're kind of talking about treatment and creating appropriate expectations. We can make these horses feel better, but we may not be able to totally reverse disease. The other reason that it's kind of important to talk about the distinction between the two varieties of asthma is that there's commonly this question, will all horses that have mild to moderate asthma progress into having severe? And the good news there is no. Like I said, we can have these younger horses that may have 1 or 2 flares of this mild to moderate, and again, environment changes, they grow out of it, whatever happens, and they may go on to totally normal athletic careers. But certainly when we look at the severely asthmatic horses, if we can trace those horses back in time, so if they've had a trainer long enough or been with an owner long enough, by the time we're diagnosing severe, if they can think back in their memory bank, often it does become apparent that at some point when they were younger, they did have that exercise intolerance and poor performance that has slowly progressed over time. So kind of my take home for that is that the sooner we can recognize these mild to moderates and really keep a close eye on them, hopefully then we can prevent them from transitioning into this severe, where we now have these horses that maybe can't do their athletic job for the rest of their life. And so asthma as a whole, it can be reasonably prevalent, and it's one of those diseases that's a little bit hard to come up with exact numbers on, because many of the diseases that we have really good statistics and numbers and whatnot on are because they're going to, you know, your big university hospitals and they're part of research studies and whatnot. And so many horses with asthma, you know, are seen by veterinarians in the field, or maybe don't even see a veterinarian, so their numbers don't get recorded. But the best numbers that we have are that those severe equine asthma cases, so those horses that have signs even at rest in the United States, are somewhere around 15% of horses, you know, will live long enough essentially to start to have some of those signs. Again, looking at hospital admissions, there was about 11% of hospital admissions, one particular study. We'll talk about the genetic predisposition, and there is actually genetic predisposition in some family lines. In those particular families, you know, upwards of 65% of horses with those bloodlines can go on to severe asthma. And then we'll talk about the summer pasture associated for any of you in the Southeast. About 5% of horses in the Southeast have been reported, specifically one study out of Louisiana State University, to have severe equine asthma. But especially for you guys that are, you know, potentially in the process of transitioning some of these younger horses from their racehorse career to their sport horse career, so if we look at racehorses, 80% of racehorses, if we do all of the diagnostics to look for it, 80% of horses while they're racing do have that mild to moderate asthma. And it's one of those things that obviously it's going to be very important in that category of horse, because they need their whole respiratory system to be able to do their job. When we look at it in sport horses, the diagnosis is closer to 20% will have that mild to moderate asthma. And so it's really, again, important for us as we take some of these younger horses, kind of recognize that they might have mild to moderate, do what we can do from an environmental standpoint, and then watch them to make sure that, again, they're not progressing into this severe variety. And so again, I did include a little bit more detail on the summer pasture associated for any of you that, again, may be in the Southeast. And I practiced in Florida for all told about 10 years. And so I feel the pain of anyone who has had to deal with the summer pasture associated equine asthma horse, because they are really, really frustrating, certainly as horse owners and trainers, but also for the horse themselves. So these particular cases are seen again in the Southeast. So kind of, you know, South Carolina, Georgia, Florida, Alabama, Louisiana, kind of the eastern side of Texas. And it is in response to certain subtropical grasses and their associated fungi. And we're kind of right now in the worst time of year for these horses. So clinical signs in them are going to be worse from late summer through fall. And again, this is a variant of severe equine asthma. So these are generally adult horses, again, may have had more mild signs and progressed over time to the point where these guys can really struggle, honestly, to breathe, and certainly their quality of life can start to really become an issue for them. And mostly I also bring up this group because it's one of the groups that helped us to realize that horses with severe equine asthma, we said, even though their signs may wax and wane over the course of the year, if we take biopsies of their lungs, we do actually note that they have this airway remodeling. And so this was one of the groups of horses that was kind of first noticed in. Now we have extrapolated it to other groups of horses as well, that, like I said, once they start to have those severe signs, it can be really challenging to reverse the disease entirely. So clinical signs of asthma, there's a really wide range. As we talk about those mild to moderate cases, it can just be poor performance that isn't even always super readily apparent that it's related to the respiratory system. Again, it's just that horse that's just not performing quite up to expectations or quite performing as well as it was before. So that can be kind of the most mild or the most subtle findings. We can also see horses that maybe do okay while they're exercising, but it takes them longer to recover. So again, they jump a course, everybody else goes back to their baseline respiratory rate and effort in a couple minutes. You know, this particular horse 10, 15 minutes later is still huffing and puffing. They can also have an increased respiratory rate and effort. Again, whether that's at exercise or at rest. They can also have a cough. And I think this is one of those things that, I get this question a lot from horse owners. My horse coughs 5 times, every single ride at the beginning of a ride. Is that normal? And it's really not normal. If you coughed every single time that you went for a run, you would probably think, there's, maybe something going on here. And so if you have that horse that is coughing, kind of clearing its throat at the beginning of every single time you exercise it, that is a good opportunity to call your vet and kind of assess, is there something more going on in here? Horses with asthma can also have nasal discharge, but usually it's kind of like this horse, if you can see it, where it is just that little clear, maybe a tiny bit of mucus. If there's a large amount of nasal discharge, or certainly if there's any color or odor to it, then we're not talking about asthma. We're talking about some sort of other infectious disease that we definitely need to look more into. Obviously, as we progress into the more severe categories of equine asthma, we can have what is called a heave line. First, we can see nostril flare and effort here. And as you move around to the side, his whole chest and struggling to breathe. And then over time, they just remodel their abdominal muscles line here from how much effort in them to breathe. And then some of these horses, again, especially with the severe ride, again, can get to where they have weight loss because they are so focused on breathing that they're not eating. And they've actually shown a horse with essentially this degree of effort. So if they have that continual nostril flare and chest excursion, it's the equivalent of trotting. So essentially, if your horse is breathing like this 24 hours a day, it's like he's trotting for 24 hours a day. And obviously that is a huge metabolic drain on these guys, and especially if they're not eating. Horses with asthma should not have a fever. So again, if your horse has a fever, we're worried more about infectious disease. Lymph nodes should be normal, and again, no color or smell to their nasal discharge. So what actually happens with equine asthma is that the airways are hyper-responsive. So horses are obviously inhaling things all the time, and we'll talk a little bit about what all those things are. But certain horses, for whatever reason, their airways are hyper-responsive to that particulate matter that they inhale. And in response to whatever they're inhaling, they get inflammation. So they get white blood cells that come into their lungs. They get this increased mucus production. So this is a picture with an endoscope down a horse's trachea. And you can see this stream of mucus here. So we start to get this increased mucus production in response to those inhaled particles. And then subsequent to that, we get what's called bronchospasm. And so all of the airways have little bits of muscle around them. And in a normal animal, that muscle is nice and relaxed, so air can kind of move through this drinking straw. In response to all of this inflammation, they can get bronchospasm where this muscle contracts. And now obviously we have a much smaller diameter. So now that diameter is full of mucus, full of white blood cells, and is smaller. And therefore, obviously, we have airway obstruction. And so these horses can no longer actually move air to their lungs. So how and why does that happen? Much like many diseases, it's multifactorial. And so environment is going to be far and away the biggest portion. And so we're going to talk about that in a lot more depth. So we know that it is, what horses are inhaling that actually triggers that hyper-responsiveness. But obviously you could have a boarding barn with 100 horses that have the same environment, and not all of them have equine asthma. So there's much more to it than just the environment. So there does appear to be some individual predisposition to develop asthma in the face of that environment. And so some of that is going to be genetic. And we'll talk about, like I said, a couple of specific genetics that we are aware of. And then so much of it is just like many other diseases where we're still trying to figure out why it is that certain horses have individual immune responses that make them hyperreactive. Without getting too far into it, it's kind of like why, so many horses get exposed to EPM, for instance, but only a couple of them actually become infected. And it's because most horses' immune responses react one way. Those horses that don't react appropriately get disease. And so individual immune responses, we're still trying to figure a lot out about how to measure that and how to predict what animals might actually have issues. And then the role of infectious disease in equine asthma, we're still trying to figure out. So like I said, environmental causes are far and away the most important, and it really comes down to what we call respirable particulate matter, or respirable particles. So respirable particles are those that are small enough to reach the lower airways. So 5 micrometers, which is very, very small, is what actually can reach those lower airways and trigger disease. And that's going to come from really all of the sources of dust in your horse's environment. So feed is actually really the #1 source of dust in most horses' environment, but obviously, you know, how their stalls are bedded can be another big one. And the other one that I think sometimes goes a little bit under-recognized is arena footing. And so we'll see this especially in places where the indoor arena is attached to the barn. Those horses in the stalls closest to the indoor, if that indoor is really dusty and you know, horses are being worked all day, those horses can be exposed to a ton of dust from that arena footing as well. Or even if you have a sensitive enough horse, just that 1 to 2 hours a day that you're working them, if they are in a very dusty arena, can also trigger issues. So there's a lot of things in that dust that actually are the triggers. And so a lot of it is going to be various molds and fungi, certainly different pollens. And so that's where, again, any of you who have dealt with asthmatic horses, sometimes you can even kind of see, you know, a certain tree blooming and know my horse is going to have issues, you know, now, because I know that that is the pollen that actually seems to trigger my particular horse. Even some of the pine tree pollens that maybe aren't as readily available or readily noticeable as some of the flowering tree pollens can be really triggering for certain horses as well. And then even just the plant fragments that are within their feed sources can become small enough that they can become inhaled. And then there's also some inorganic particulate matter that can trigger horses. So, you know, even in the areas that maybe environmentally don't have as much asthma because they don't have a lot of these molds and fungi and pollens, you know, some of our drier environments maybe don't see as much asthma as some of our more humid environments. But if you have a horse that is in a stall that maybe is not very well cleaned and there's a lot of ammonia in that stall, you know, anyone who's been in a poorly cleaned barn, you kind of know that feeling of kind of that nostril burn from the ammonia from their urine. That's really irritating to horse lungs as well. We can also see asthma flare-ups in horses when there's wildfires. So again, for any of you potentially, you know, on the West Coast where there are some fires currently, that can be enough to trigger some horses. And then there's actually also been some studies showing that horses in barns along like major roadways and highways and turnpikes and whatnot can have an increased incidence of asthma just because of the exhaust fumes that they're continually exposed to. So environment is definitely the main triggering factor, but like I said, there's a couple other things that kind of put the horse in that situation where if they're triggered, they're going to react. And some of that, like I said, is some individual genetics. And this was actually first recognized back even in 1939 by a Swedish researcher who noticed that one affected stallion, about half of his offspring would go on to have severe equine asthma over the course of their life, and started doing some various breeding trials and whatnot. And have come up with several different warm blood and Lipizan families that do have an increased incidence of equine asthma. Interestingly, it's actually the same in people. So it has actually been shown, you know, to choose your spouse wisely if you want to have college athletes as children, because two affected parents, this is human parents, not horse parents, two affected human parents, you know, 85 to 90% of their offspring will have some degree of asthma as well. And so again, somewhat similar in horses where, you know, one affected parent, at least 20%, both affected parents, upwards of 50% in some family lines. Again, obviously, like I said, right now, fortunately, for the thoroughbred breed, we don't see it as an inherited issue in thoroughbreds. And even in these other families, we're not far enough along yet to have a genetic test. So it's not like, you know, PSSM or HYPP for anybody who has any, you know, quarter horse experience, where we have an easy, you know, pluck some hairs and send it off. It's a little bit more complicated than that, but I think, you know, down the road, it may be something that we can do some screening for. And then the role of infectious agents in equine asthma is something that we're really still trying to figure out. And there's somewhat conflicting evidence. You know, bacteria, there have been a couple of studies that have maybe shown an association, but probably not a cause. But I think really looking at viruses is the thing that is most interesting to us as veterinarians, because we know that in human medicine, you know, if you are someone who is predisposed to asthma and you get the flu, that often is going to trigger some asthma kind of over the subsequent couple of months, even as maybe the actual acute flu virus has resolved. And if we think back to what influenza does, it actually, so this is a microscopic view of the airways. So these little finger-like projections are what's called cilia, and they should line all of the airways. And what they actually do is to help kind of flush out or sweep out dust and inhalant particles. What the flu does is when any animal, yourself or your horse, gets the flu, is it goes in and actually wipes out all of those cilia. So this is actually a picture of a horse with flu, where there's just these couple of little islands left. And so obviously it kind of makes sense that if you don't have that normal kind of cleaning mechanism, for lack of a better term, for their lower airways, that might set them up for asthma. So there's still ongoing research really trying to make that association. Two other viruses that in a couple of studies have been shown to potentially have an association with equine asthma are equine herpes virus 2. So your horses are currently, hopefully, vaccinated against equine herpes 1 and 4. Equine herpes virus 2 is one we don't currently have a vaccine against. And then there's equine rhinitis A virus is another one that has been associated with equine asthma in some studies. And so the evidence is still a little bit loose, but kind of my take home on it is that, you know, the best that we can do with vaccines and good biosecurity. So again, when you get a new horse, keeping them separate from the rest of your herd, or as soon as any horse has a fever, removing them from, you know, where they would have contact with another horse. Anything that you can do to prevent transmission of infectious diseases, infectious respiratory diseases, is going to make it less likely down the road for your horse to have long-standing respiratory issues. Okay, so moving on to diagnosis of asthma. So obviously history is huge. And then as veterinarians, obviously we're going to do a good physical exam. So again, taking temperature and heart rate and respiratory rate, palpating lymph nodes. Again, nasal discharge and cough are going to be a big part of the history. But a lot of what we're trying to do as veterinarians, if you call us and say, you know, I think maybe my horse has a respiratory issue, is try to figure out, is it coming from their upper airway? So is it coming from their nasal passages in their throat? Or is it coming from their lower airway, therefore being their lungs? And so things that can help us to do that are to figure out, you know, do they have normal airflow through both nostrils? So actually just feeling both nostrils. You'll see us sometimes knocking on their heads to see if we can hear anything that would be in their upper airway. And then we're going to listen really well to their lungs. And this is something that can be really challenging to do because often we're listening to horses in areas that have a ton of background noise. So certainly, you know, when your vet gets out their stethoscope, if you can help them by trying to quiet environmental or quiet noises around there, will make it easier for us as vets to get a good listen. Because sometimes we're listening for some pretty subtle things. We're listening for things that are described as crackles or wheezes or rattles, just things that tell us, again, that the abnormal response in your horse is coming from their lungs because they have fluid or mucus down there. Just listening to them at rest can be really challenging. So you'll find often something that we're going to do as veterinarians is what's called a rebreathing exam. So if you've ever seen a vet take out a garbage bag and put it over your horse's nostrils, it's not that we're trying to actually suffocate your horse. It's that we're trying to make them take deeper breaths. So when you go to the doctor, you know, they put their stethoscope on you and ask you to take a deep breath, and presumably you do. We can't ask our horses to do that. And so by making them rebreathe their own exhaled air, that makes them take deeper breaths so that we can listen to some of those more subtle abnormalities. And also sometimes we can actually make them breathe hard enough to make them cough or to make them do some things that make it easier for us to say, yes, you know, we need to keep looking at their lower airway to figure out why the horse is not performing up to expectations or has a cough or whatever the abnormality might be. Endoscopy can also be a portion of our diagnosis. And so we can look at both their upper and their lower airway. And so like I said, a lot of our job is to figure out is it upper or lower. And so especially, obviously, many of you clearly obviously have an interest and an enthusiasm for the racehorse. You know, so many of them do have upper airway issues as racehorses. So things like roaring, where they may have had a tie back, or they may have had issues with soft palate displacement. So all of those sorts of things, you know, we may look at rest, especially again, if maybe we know that the horse had a tie back surgery because he was a roarer before, you know, let's see if that still is intact or if there's an issue there. So we can do that at rest, or some of you may have seen these dynamic endoscopes where we can actually put a scope on and then ride the horse and see what the horse is actually doing at exercise. Because a lot of times, you know, the noises or the issues that they may be making aren't readily apparent at rest, but as soon as we put them in a certain frame or again, make them perform at speed, we may actually see an issue. So scoping can be helpful to figure out, again, is it an upper or lower airway issue? And then we can also look at their actual lower airway. So we can take that scope and dive down their trachea. And this would be a normal looking trachea. So there's a scoring system. So grade 0, there's no mucus. A grade 5, you've got essentially this lake of mucus in their trachea. And we have actually, there have been studies to correlate this. So a thoroughbred racehorse, if it has a grade 2, so essentially if it has droplets of mucus even within its trachea, that actually has been correlated with decreased racing performance. A grade 3 tracheal mucus score, we essentially have a continuous stream of mucus that has been associated with reduced willingness to perform in a sport horse. So again, this can help us to even determine kind of the clinical relevance of what is going on. Blood work in general is not super helpful in terms of diagnosing asthma, but may help us to rule out some other things. And then same with x-rays and ultrasound. They again can be helpful for some of our infectious diseases and whatnot, but in general, a horse with just equine asthma will have normal x-rays or ultrasound. This is an x-ray of a horse with a very bad actual pneumonia. And I mentioned earlier pulmonary function testing, and the only reason really that I bring it up is that it is still considered the gold standard. So many research type institutions, when we're looking at different treatments or those sorts of things, may still use pulmonary function testing, but it's something that currently is not widely clinically available. Some of the different university hospitals have it, so some of you may have had some experience with it if you've had to take a horse in, but right now it's not something that's really done in the field very much, but there are a couple of groups that are pretty close to actually devising some stall side tests, which is actually going to be really kind of game changing for us in terms of our ability to diagnose, especially some of these really mild cases of equine asthma. And then you may have seen us do respiratory secretion sampling to confirm a diagnosis. And so bronchoalveolar lavage, or BAL, is what is done often to confirm a diagnosis of equine asthma in many horses. So some of you may have seen this performed. It's done under standing sedation, so it's really probably more traumatizing for the horse owner than it is for the horse itself, but can be done either through a tube or through a 3-meter scope. And really all that we're doing is we're putting fluid in your horse's lungs and then sucking it back out to then be able to look at the actual cell types to give us an idea, are the overall numbers of cell types abnormal, as well as the different types of cells that we might see in there to help us to confirm that diagnosis. Okay, I'm going to move on to treatment. So when we start talking about treatment of equine asthma, there's really kind of 3 steps to it. And far and away, the most important step is that environmental modification. And it's most important, I will freely admit, it is not the easiest. So for any of you who have really dealt with this, it can be a big old pain in the butt to actually be consistent and to really stick with the environmental modification. But it really is the most important bit. Step 2 of treatment is where we start talking about drugs. So steroids are in general going to be step 2, and that's going to help with that inflammation. And then step 3 would be our bronchodilators. Because again, if you think back to what I talked about in terms of kind of what happens with equine asthma, that bronchoconstriction is really secondary to some of the inflammation. So we're usually going to go steroids first, plus minus bronchodilators, and we'll talk about that in a little bit more detail. Like I said, really the environmental exposure is really the most important, because drugs are only transitory. Kind of our goal is to get environment as good as we can and then only really use drugs when we have to. So this is a study that was done in Canada several years ago, but I think it graphically depicts some of my points well, so I'm going to kind of walk us through it. So the y-axis here is what's called resistance. So this is actually looking at really kind of how well the lungs are working. You can think of 1 as a normal number for pulmonary resistance. So our goal is to get our horses at less than 1. So these horses all started at 3, so they all had signs of severe asthma. And they were divided into 2 groups. So the open white circles here, this group of horses was turned outside and was fed a pelleted feed. So they did not have any drugs, but were just turned out and had full environmental modification. And you can see it took 6 months of turnout and pelleted feed to get them down to a reasonably normal number. So it's a long process. And so I bring that up because I think it can be really frustrating, because it's a lot of work. I'm not undervaluing how much work it is to actually do the environmental changes. But I think sometimes, people will do it for 2 weeks or a month and maybe not see a huge change in their horse and get frustrated and say, this just isn't really worth it. But I think this study nicely points out that you really need to stick with it. The other thing that is in the study, so except the horses were divided into groups, the little filled in triangles here, these horses got inhaled steroids. without environmental change. And you can see they got better much faster, but then kind of plateaued. At the 6-month mark, these horses also got environmental change in addition to their inhaled steroid and got even better. And so this is, I think, where it again nicely points out environment's going to take some time, so be consistent and stick with it. If the horse is really struggling, or again, we need to be doing something with them, drugs are going to make them feel better faster. So great, let's use drugs, to get them feeling better. But then if we can also still layer that environment on top of it, we're still going to get an even better response to our drugs if we can really do both together. So what are all of those environmental changes that we talk about? The easiest is that horse that really struggles in the barn. If he can just live outside, that may be enough to fix some horses, but obviously that's not always practical because of all of the various ways in which we manage horses to keep them doing their jobs and to be athletes. And so if they have to be in a barn, bedding can be important. And so we know that straw is the biggest offender in terms of the amount of dust and pollen, dust and mold and fungi that horses are exposed to. So getting rid of straw and going to a wood shavings or wood pellet can be helpful, sometimes even dampening those a little bit. There are also some commercial, cardboard and paper products that are very, very low dust. In some horses, even just going to, black rubber stall mats. It doesn't look pretty, but it can be quite effective for some horses if they're really triggered by anything in their environment. We also encourage people to don't have the horses in the barn while you're cleaning. You've all, again, shake a pitchfork and you see all that dust as you're shaking the pitchfork. If the horse is in the stall while you're doing that, they're being exposed to all of that dust. So turn them out while you're cleaning. Even just, again, misting the barn aisles before you sweep will help those dust particles to stay settled. Don't use a leaf blower on your barn aisles. It's the easiest way to, clean your barn aisle. But when you do that, it stirs up dust that actually stays airborne for upwards of 4 hours. I think a super easy test, honestly, just to see kind of how dusty is your stable environment, is just hold up a flashlight, or, again, if the sun comes through a window or a doorway at certain hours, if you see particulate matter, if you see dust floating in the air, that is not good. That means that we have too much dust in that environment. Don't store hay or straw above the stalls. Even with tarps and whatnot, it does still sift through and increase the dust in that horse's environment. And then, like I said, pay attention to the footing as well. People have looked at trying to do ionizers or water nebulizers. So just like there's the fly spray systems in stalls, people have kind of said, okay, well, if we continually mist them with water, does that help? And unfortunately, it doesn't. While it may settle dust a little bit, it increases that mold content enough that it really offsets it. So that's not horribly effective. Sources of feed are another big source of dust in our horses' environment. So in some horses, especially if they're severe and it's acute, we may need to go to a complete pelleted feed for some period of time. Obviously, for a multitude of reasons, we don't want to keep horses on complete pelleted feed if we don't have to. It's better for their GI health and certainly their brains and their behavior and all that if we can give them some forage source. So if we have to do a pelleted feed, short term, great. Then if we can switch them to some sort of forage, most of them will do better that way. And there are several ways we can do that. So either you can take your hay and soak it. By soaking it, though, again, it needs to be bare minimum of 10 minutes of being soaked. So just misting it with the hose before you feed it is not going to be effective enough at actually removing dust and kind of reaching the middle of a flake of hay. So soaking it for at least 10 minutes. Some of you may have a hay steamer. The hay steamers are great. There's a little bit of upfront expense there, but are quite effective at decreasing dust. And then haylage is not something that's often been thought of as a popular feed source in the United States. It's still used a lot in the UK, but it can also be a very good low dust source of forage. And so again, this study is really comparing the amounts of dust between regular hay, steamed hay, and haylage. And you can see both steaming and haylage have significantly less dust. Also, feeding horses on the ground. So it has been shown that feeding horses in an elevated hay net increases how much dust reaches their lower airways fourfold. So even if you are someone who by soaking hay, if it's easiest to put the hay in a hay net, soak it in a tub and then just pick the whole hay net up for ease sake, that's totally fine. Just don't then hang the hay net. Either dump the hay net on the ground so that they actually have to eat off the ground. And then unfortunately, round bales are about the worst thing we can do for our horses' respiratory health because they do this, where they all bury their head in the middle of it. So they're inhaling everything, plus the middle of the round bale often has a fair amount of mold and fungus potentially growing in there, depending on how long it has sat out. So again, if your only hay source, especially certain times of year, is a round bale, I'm not going to fault you for that. My recommendation is just always keep the round bale outside of the turnout and just pitchfork piles of it off to feed to the horses so that they can't bury their entire head in the middle. So the environmental stuff, like I said, it's easy to talk about, but it'd be harder to implement, but is really important to do. But again, if we have a horse that is severely affected, we may want to treat them initially to try and dampen down that inflammation. And so we may reach to steroids. And so there are two ways that we can give steroids. So either we can give them systemically or we can give them via inhalation. The main systemic steroids that people are probably familiar with are going to be things like dexamethasone, prednisolone, or triamcinolone. In general, systemic steroids are pretty cheap and easy, which, we all like cheap and easy. But the risk of them is that the entire body is being exposed to them. And so certainly in certain horses, that does increase their risk of adverse effects. And so we measure that by something that's called cortisol suppression. But I think, the greatest fear we all have, certainly as veterinarians as well as horse owners, is that when we give a systemic steroid, could we induce laminitis in that horse? And that, again, there's not honestly a ton of research that shows that it happens, but anecdotally, we've all had it happen to us. And so it is quite scary. We also know, depending on the steroid dose, that we can actually suppress their immune system. And in some cases, we essentially cause Cushing's disease in those horses on systemic steroids. So we've looked at various ways of giving inhalant steroids. So fluticasone and beclomethasone are two that you may have given that, again, are designed for human use. So they actually come in the little puffers. Or dexamethasone is something that I know people are nebulizing quite commonly. The goal, obviously, with inhalant steroids is that we're delivering maximal drug concentration to the site. So we're just delivering drug to the lungs. And so we're hoping that we're minimizing systemic risk. And again, honestly, there's more and more evidence coming out that even with the various ways that we currently have of giving inhalant steroids, that there is still a fair amount of systemic exposure to those drugs. And then we also hope that we have shorter drug elimination. So again, obviously, if we're in disciplines where drug testing is important, in general, giving inhalant steroids, you have a shorter withdrawal period than systemic. The problem with inhaled steroids is that they are, in general, expensive and require some way to actually administer them to a horse. And we'll talk about that in just a second. And then bronchodilators would be that third step. So like I said, often we're concurrently using steroids and bronchodilators for some period of time. The bronchodilators, again, can either be given systemically or via inhalation. The main systemic bronchodilator is clenbuterol or ventopulmin. Again, they're reasonably easy to use because we're giving them orally. There is some evidence that they may also help them with that mucociliary elevator. So that's that little kind of sweeping mechanism I was talking about earlier, and may allow a lower steroid use. The problem with our systemic bronchodilators is that over time, the body starts to downregulate their response to them. That's something that's called tachyphylaxis. So they generally only work for a couple of weeks to a month. In general, having them on lifelong is not really our best approach for these guys, and they get expensive. And then there can be some risk of systemic effects, especially if an animal gets overdosed by accident. So if the weight was inappropriate or something like that, if a horse gets too much of a beta-2 agonist, they can get quite excited. So then we can also look for inhaled bronchodilators, and albuterol is going to be the main one that's been used. Again, same theory where we're giving it to the drug, giving the drug directly to the lungs. And if we think about even, again, for any of you who may have asthma as people, the rescue inhalers that people use are all bronchodilators. So these are going to be short acting, they're quick acting, but they also don't last very long. But again, if an animal is in acute crisis, an inhaled bronchodilator might help them feel better much, much faster. A lot of people might also use an inhaled bronchodilator before an inhaled steroid to essentially kind of open things up. Again, the problem being that they require an administration device. And so the administration devices that we currently have are either using, again, these human meter dose inhalers or MDIs and putting them on something that's called a spacer, which then fits over the horse's nostril. So some of you may have used the AeroHippus, again, where we would put the inhaler in there, you squirt it into here, and then the horse inhales the next time it actually breathes in. Again, this is all use of human drugs. Really best case scenario, the best research that has been shown with the AeroHippus and with fluticasone is about 18% of that drug actually makes it to the lower airway. And so it's the best that we're able to do with that combination. And then the nebulizers really have taken off over the last couple of years. You know, there used to be this old jet nebulizer, which was awful. And for any of you who used it, you know what I'm talking about. It sounded like a jet engine, and it took forever, and it was just a bit of a nightmare. The FlexiNeb is the one that's more common now in the United States. So it's battery powered and certainly quieter and faster. The Sahoma, some of you may have used as well, but I think the FlexiNeb is the more common one in the United States right now. Again, you know, good in theory, but again, best evidence of nebulization in any species, people included, is that about 20% of it makes it to the lower airways, that much of it is still being swallowed and intestinally absorbed. So even if you are using a nebulizer, you know, certainly still important to watch those horses for systemic signs. Things that haven't been proven to work for asthma, so non-steroidal, so things like phenylbutazone or Banamine or Flunixin, unfortunately don't work for asthma. They're not essentially a potent enough anti-inflammatory to help our horses that truly have equine asthma. Same with antihistamines. So really, again, for horses that truly have equine asthma, in general, antihistamines are thought to be ineffective. There are some other sorts of issues that horses might get, because I get this question a lot. You know, my horse seems to do better on antihistamines, so something's obviously wrong with him. A lot of times these are more kind of allergic responses in that upper airways or in the nasal passages and whatnot. Those horses might actually respond to antihistamines. But in general, horses that truly have asthma in their lungs generally don't show a very good response to antihistamines. And then immunotherapy. So people have looked at, you know, either serum allergy testing or intradermal skin testing. Really, in terms of the serum allergy testing and treatment based upon it, there's not great evidence that that helps horses' airways. The intradermal skin testing and subsequent treatment, there's kind of some conflicting evidence on how much it helps horses. So I certainly, when I'm talking to owners about it, I can say, you know, again, if you've got money to spend and you want to try it, probably not a huge downside, but don't go into it, you know, with lofty expectations that it's going to help every single horse. One thing that has been shown to help horses with asthma is omega fatty supplementation. So this study was done at Purdue and published back in 2015, that horses given increased amounts of omega fatty acids in combination with environmental change had a significant improvement in their cough score relative to horses that did not have environmental change or omega fatty acids. So again, that's something that's, again, pretty low risk to try in a horse and may have some benefit as well. So really, you know, equine asthma, there's a spectrum of clinical signs everywhere from that very mild case up to that horse that really struggles to breathe, you know, on an everyday basis. The earlier that we can catch these guys and really pay attention to their environment and to how we're feeding them and all of those sorts of things, the better. Because again, if we can break that cycle, whether it's still a mild to moderate asthma case, then great, they may be a one and done and never have issues long term. You know, but if you're acquiring a horse that already has signs of severe equine asthma, there's plenty that we can do to help their clinical signs and to make them feel better. And in many cases, still to be some degree of an equine athlete, but we're never going to fully reverse that disease. And so again, we just need to have those reasonable goals and expectations going in to what we're going to ask that horse to do as an athletic career. And then, like I said, really the environment is far and away the most important, and then we use drugs as needed. So with that, thank you to the Retired Racehorse Project for having us. I'm sorry that I won't get to see many of you in Lexington in October. I usually am there every year and it is a fun weekend, but I look forward to seeing everyone in 2021. And with that, I will attempt to take some questions.
I see one question on Zoom that I can answer very easily. Does anyone know if they'll be providing the recording of this afterwards? Yes, so that's being recorded on our Facebook page right now. And we will also upload the Zoom recording of this onto YouTube, so you can rewatch this later because there's lots and lots of great information. So I think a lot of us are going to want to rewatch this again. So
Or, you know, if you have trouble sleeping at night, you can just listen to my voice over and over again.
I would love to have you read us, some bedtime stories, Dr. Sarah. You have a lovely voice. I have a question. So how effective are like sort of over-the-counter like wind aid? I know there's one actually called wind aid.
Yeah, it's a good question. So yeah, in terms of supplements, there really is no evidence that any of the various supplements or over-the-counter things really have any sort of effect. You said the only kind of quote unquote supplement that has any research backing to it are those omega-3 fatty acids.
Which actually transitions well to the next question that I just saw pop up. What omega fatty acids do you recommend?
So that particular study that was published was done with Alira, was the one that was shown to have, again, the 1.5 grams of DHA. But that's the other thing is, and I can even go back on the slide maybe, is like I said, not to support one over the other, but they did pay for this study. So again, this was done with Alira, but if you're using a different sort of supplement, really the thing to look for is that at least what appeared to be significant was this 1.5 gram of DHA was the dose, so to speak, that was used.
There's a question in the Q&A, which I can attempt to read. What symptoms would trigger you to administer fluticasone versus using it preventively?
Yes, so fluticasone is one of the inhalant steroids that we have. And I wouldn't really ever use it preventatively, so to speak. And I know people kind of do that. But really, in general, again, if I'm talking more prevention, I'm going to be doing all of the environmental stuff to decrease the dust exposure on that horse. And if you want to give them some omega fatty acids, great. But fluticasone, again, as a steroid, there is still some risk to it. It's also not inexpensive, but there is more and more evidence that it actually, even when we're giving it via inhalation, that there is still some systemic exposure in those horses. So I really try and reserve it for a horse that truly has actual asthma. And so the signs we would see would be that, cough, exercise intolerance, poor performance, up through that horse that obviously has an increased respiratory rate and effort.
Right. Any other questions either on Facebook or on Zoom? And if you folks on Facebook or watching this again later on YouTube, if you guys do have questions, you're definitely welcome to leave those in the comments, and we will do our best to get those emailed over to Dr. Sarah, and then hopefully she'll be able to answer those for us. So, so if you're watching this on replay and you have questions, definitely feel free to shout out, or you can also email those to info@retiredracehorseproject.org. I don't
promise I will do my best to answer them.
Right, yes. Yeah, you definitely want Dr. Sarah's answer and not mine. So. All right, there's another question from Anne in the Q&A.
Let's see, so if I have a horse that's been diagnosed with asthma, would you just use the fluticasone when he's symptomatic? I would say in general, yes. So yeah, those horses that, again, we kind of know they wax and wane, with various, again, whether it's a certain pollen or something like that. If he has asthma, then I would, again, kind of baseline do all the environmental stuff. And then, as soon as I start to see an increase in his clinical signs, so again, if that's a horse that coughs or, again, just kind of backs off his work ethic, whatever that might be, then I would put him back on fluticasone. And it's, it's always hard. People always want kind of, drug doses and kind of a cookbook recipe. And asthma is one that's really challenging. And so it really takes kind of careful communication, honestly, between, you as trainers and riders and veterinarians, because you often are very tuned into the horse and can kind of say, okay, at this dose, this horse did great. As soon as I started to taper him down, all of a sudden he didn't do as well as again. And so then I often kind of bump them back up to the last dose that worked. And so it is something that really kind of takes a lot of kind of playing with them. And one of the things I certainly encourage, riders and trainers to do is to, keep a little diary of kind of the horse's, respiratory rate and effort, number of coughs, anything else that you notice can really be helpful, because often we will start to see, correlations between whether it's certain times of year or certain types of allergens or something else that changed in that horse's environment, to where we can kind of predict some of these issues. And then also, like I said, if you kind of have a good log of what their rate and effort and all those things have been, we can kind of say, okay, you know, this is the dose and frequency that seems to work for this particular horse, because it's not always the same across all horses. You know, some are really sensitive, and we can get them down to really low drug doses, or sometimes horses that maybe we only have to treat, you know, every other day or every 3 days, versus those that have to be treated twice a day. So really, you know, careful record keeping can be super helpful. I'm sorry for Anne, who has been dealing with asthma for several years, because it is not fun.
A new question, Colleen. Can allergies, including nasal discharge, sneezing, heavy breathing during exercise, turn into asthma?
Yeah, so that's a really good question. It opens up kind of some terminology and whatnot that gets really confusing, because I think there is often kind of this, you know, question, is asthma an allergy? And in some cases it can be, because it is still that, again, that immune response to things that are inhaled. But for the most part, most of the classic equine asthma that we see, you know, is not the same as a hay fever type allergy that we would see in people. There are some cases where it can be. And so it's not necessarily that one turns into another, but it can be, again, one of the benefits of doing that BAL that I talked about with your veterinarian, to see, because the certain types of cells that we might see in that fluid can help us to say, okay, is this a quote unquote classic asthma, or is it one of these that maybe has one of these more kind of allergic types that we may play with some different things in? And so it gets to be really confusing, the terminology between allergies and asthma.
We have a question on the Facebook video from Carling. When a horse diagnosed with summer-associated heaves is moved to another location and the symptoms seem to reside in the new environment, how much inflammation could be occurring in the lungs that you cannot see? Is it possible that the lungs are still remodeling, and should the horse be given a steroid during months that used to be an issue, or only when symptoms are visible?
That is a great question. And we don't really have a good answer to that. I actually was talking to someone who does research on that particular, so on summer pasture-associated asthma, and we were kind of talking about that, and would there be a way we could actually do a little research study to look at that? You know, my answer to that is, you know, so we do know that horses with summer pasture-associated do have some of that remodeling. I guess I would say, having had a lot of horses in Florida that I did send to other environments that did well, I wouldn't prophylactically treat them. So again, let's say it's a horse that lived in Florida, did awful every August. If I now moved the horse to Colorado, would I go into every August saying I'm going to have to treat this horse? No, but I would probably go into August talking to, you know, that owner about, let's keep a really close eye on him. Again, if he develops a cough, if we start to see an increase in his respiratory rate and effort, you know, then let's get on top of it early. In terms of how much that remodeling can go backwards, we're still really honestly trying to figure that one out. And so we don't have a good kind of research-based answer to that right now.
Good question. All right, so once again, folks, if you guys have any questions and you're watching this on replay, feel free to leave them in the comments, and we will do our best to get those over to Dr. Sarah to answer for you. And unless I see any other questions pop up, I guess we can probably wrap it up. But thank you again, Dr. Roos, for spending your time with us this evening. And I think this was a really, really informative webinar, and looks like lots of people tuned in. So I think this is going to be a popular one for people to rewatch later too. So
excellent. Well, again, thank you for having us.
All right. Have a good night, everybody.
Bye-bye.